Hello, and I'm Nicola Williams, Director of Support and Delivery, and I'm really pleased to welcome so many of you this afternoon, and people are joining as I'm speaking. So that's fantastic that you've made the time today, and to a programme aimed to uh, Hi everybody. Sorry for the false start. I think I've got too many screens open, so we had a bit of feedback there. But anyway, today's programme is really aimed to acknowledge the past year, but also one that we hope looks forward and builds on the learning that we've had this last 12 months and longer, and towards the future and the opportunities in that and the impact that we can all continue to make. So firstly, my perhaps my main message today is a thank you to you all for what has been a pretty remarkable year. Two little words, or here one in Welsh, seems very inadequate to the depth of thanks and actually the pride I wish to convey. So I'm purposely pausing on this slide as it's a thank you for the support that you've given research, whether that's as a public contributor, and I know we have some public contributors on today, whether it's as your role in a delivery team, in a research office, or working at a national level. And it's really a thank you for the work that you've done and the contributions, but also the sacrifices that you have all personally and collectively made. And whatever that contribution is, I know you've been supporting patients and families and supporting each other and recognising that we all also need to have time to ourselves so that we can do it all again tomorrow. And I know at times that you, like me, have had to dig deep, and it's recognised. And tomorrow we'll acknowledge just some of those individuals and the teams in the awards section at the end of the event. And many of you have been keeping critical non-COVID research going, and we want to recognise that in the programme today too. Many of you were deployed to the front line, to the clinical service, to roles well outside comfort zones. And, frankly, we've been doing all of that in the middle of what is a war zone, effectively, and an extended one at that. And that is what is remarkable. So two or one very big words, diolch, thank you. And here's what you've contributed. Whether directly or indirectly, we've completed research delivery and implemented research findings on a topic that we'd not even heard of a year ago: reducing hospital stays, changing lives, finding treatments, finding opportunities, supporting the UK and the global research endeavour. And the speed of it, I was trying to think what the word is. I've put exhilarating. I say exhilarating because never in my career has it been seen the pace of the change from an idea into routine care. And it's been really motivating. We've seen the impact that every single conversation, every decision, every push that everyone has made has really made to that effort. And the responsiveness of Wales, of us, and our contribution to what's on this page is highlighted regularly at a UK level. And a couple of years ago, I spoke at this event of Frank Williams, who's the chief exec of the Formula One's team, or was, and the mantra being, does it make the car go faster? And little did I know that that message to what I did last year and what you all did, but would be so critical. So we came together in March 2020, both in Wales and across the UK, and we had a really focused objective, obviously: find treatments for COVID that worked as fast as possible. And you'll see there on the top right, it meant that study setup, we were counting in days and hours, not in weeks and months. Before COVID, it was potentially taking on average 100 plus days to set up a research study, and we were doing it overnight for some of those studies. Jane Goodwin and I set up a coordinated study team and became the single front door to most of the urgent public health research delivery in Wales. And the impact that had was to enable all of the health boards and all of the NHS organisations to have access to the studies that were going to be the critical pathway for treatments for patients that you were seeing through the hospital doors and in primary care. And that ensured we spread it across the NHS, and that we, with you, demonstrated to the rest of the UK that the impact that One Wales can really make. And you'll see the figures from the main platform trials there, and they're the examples of what we've achieved for working together so far. You know, 36,500 people is an awful lot of people. But of course, it's not all about COVID research. And many of you have kept the show on the road for non-COVID studies, and this has been high profile in our UK discussions too, studies that are critical to the treatment of other conditions such as cancer. And so the pie chart there shows the overall numbers of studies active in Wales, how over 400 other studies are ongoing, some paused during the first wave and some restarted, and others are new. And it shows that all of the studies that are paused, many are due to ongoing disruption in clinical services, but will be a focus in the coming months. And as part of the UK vision for clinical research delivery that Caris will talk about shortly, we'll hear about how we'll be implementing a managed recovery process for those studies across the UK. And this past year has enabled us to really test the ambitions that I spoke about at a previous event of the One Wales support and delivery service. And everyone here is part of that. And that's going to be a key part of our implementation of the UK vision. Again, Caris will touch on that. And in fact, much of the programme in the next 24 hours will share how aspects of that service were developed rapidly over the last 12 months and gave us the opportunity, in a sense, to test some of those ideas and put them into practice at a scale and pace obviously we weren't anticipating. But we'll hear from Helen and Fiona about a different approach to costings and contracts and how we operated a One Site Wales for vaccine trials from Jane and Andrew and Orod. And we'll also hear about other settings, how social care's responded and how digital solutions will be critical to support us in the future. We'll also hear tomorrow about how other organisations, our partners like HRA, have adapted and continue to respond and continue to streamline approvals and making research easier and transparent as well as safe. And you'll have seen from my earlier slide, you know, communication has been key through all of this to recruit participants, to inform the public, to share findings. And so we'll hear about the Communications Alliance, led by Felicity, supported study delivery and kept research centre stage in Wales, as well as supporting the UK. And of course, those that volunteer for research should have the best experience that we can provide. And our colleagues from NIHR will share some impact patient experience tools, and we'll look at what they can do at a study level in real time. And as you hear from Andy from NIHR, I invite you to contribute to that conversation and continue to discuss with us how we can embed some of those tools perhaps in your study delivery processes. So we've all learned a lot this last year, and I guess that's where we start our programme. So Kieran will share with us the wider system learning from COVID and reflect on what we're yet to discover.